Hi everyone, my name is Zoe Bertone and I am presenting with Gabby LaFlamme and Sarah Kelly. And today we'll be talking about disenfranchised grief surrounding COVID-19. First, we wanted to take the time to define disenfranchised grief. The official definition is the grief that persons experience when they incur a loss that is not or cannot be openly acknowledged, publicly mourned, or socially supported. There are many different types of disenfranchised grief, so we wanted to take some time to talk about the relation to COVID-19 and provide some resources to people that may be experiencing this. No matter if you've experienced COVID-19 or know someone who has, you might be experiencing grief. I bet each one of you has been feeling differently since returning home and leaving your routine. I know I have. People's lives are changing greatly and may be this way for the foreseeable future. The world as we know it is changing. And this is not something that most people are talking about, but is very important to recognize during this trying time. First, we are going to talk about familial grief. This is often felt by family members and friends who have someone that they love going through this or have lost someone to COVID-19. If this is something that might be uncomfortable to talk about during this time, feel free to mute the presentation for the next few slides. It is most important to take the time that you need during this time. Displayed are some of the ways that family members may be experiencing disenfranchised grief. People may feel like they cannot support their family members as they are not allowed to go to the hospital. This can be very difficult with the nature of the disease. It tends to be very abrupt and difficult to watch your loved ones go through. Normally, when a loved one is sick, you can visit them at the hospital and provide them with necessary resources, but during this time, that is not possible. I also thought about the potential stigma that comes from a family member having COVID. People may feel uncomfortable to share that with their support system because of the fear of alienation.
When looking at disenfranchised grief, there are forms of categories that establish what it means to be experiencing this sort of grief. First would be the relationship is not recognized. This is the underlying assumption that closeness exists only with spouse and immediate family members. A good example of a relationship that may not be recognized specifically during this pandemic is the relationship between nurse and patient, and how that can be really traumatic for nurses saying goodbye to people they care for, specifically when their families can't be there. Next stage is the loss is not acknowledged. For example, prenatal deaths, abortions, and pets. These may seem not as significant as other deaths, but can still have a huge effect on people. And last is that the griever is excluded. This includes people who are not viewed as capable of grief, for example, persons with developmental disabilities, dementia, elderly, and very young children. Next, we will be talking about the nurses of COVID-19. So why focus on nurses? Exhaustion, frustration, and feeling overwhelmed has become a daily norm for many of our beloved medical professionals who are on the front lines fighting COVID-19. Nurses are in charge of caring for dying patients as well as being their only support in time of death, since family members are not currently allowed in hospitals. This is seen as disenfranchised grief because the relationship is not recognized. This has become so traumatic for nurses that there has been cases of suicide amongst frontline workers. The New York Times believes that there will be another pandemic after COVID-19, and that will be suicide. Due to loss of loved ones, social isolation, and the inability to correctly connect with healthcare professionals, there might be another huge issue at hand. I looked specifically at ER doctor Laura Breen. I saw her case one night on the news and knew it was something that needed to be mentioned. ER doctor Laura Breen, due to the pandemic, took her own life in response to the pressures at work. Before her death, she had been talking about how crushing the experiences were for her and other doctors on the medical front lines, especially noting how hard it was not to be able to save COVID-19 patients. And I think this is just one case out of what I've heard of many that just shows how traumatic this has been for nurses and the inability for them to really grieve what's been happening.
Next, we will talk about job loss and COVID-19. As a result of the COVID-19 pandemic, over 30 million people have filed for unemployment benefits. Losing any job can take a significant toll on an individual's self-worth and sense of self, but losing a job during the uncertainty and social isolation of a pandemic only makes it more difficult to cope with. That being said, many of those who have lost their jobs have families that they need to focus on taking care of, so they may not have the chance to process or properly acknowledge the grief they might be feeling at this time. Although involuntary layoff impacts the individual's family, friends, community, and former coworkers and managers, the impact of the loss is felt most directly by the individual, and the resulting grief must be recognized and mourned in order for the person to cope. That being said, much of the literature aimed at the unemployed ignores the grief attached to job loss. Society expects these individuals to simply forget their anger, sadness, or resentment and move on to their next job. The natural mourning process of job loss is simply ignored and invalidated, and the grief of the unemployed is disenfranchised as a result. Despite society's disenfranchisement of unemployment grief, studies show that job loss does, in fact, result in a grief response. In addition to loss of employment, job loss can cause one to lose their income, financial security, social status, family role, social contact, and their daily routine. Research shows that these losses can undermine one's overall well-being. However, the intensity of grief symptoms is dependent on the individual's beliefs about the value of work in one's life and the perceived importance of their former occupation. Relating this to Professor Dunlap's wheel model, an individual whose identity wheel is only held together by their work may have a much more difficult time coping with job loss than somebody with a wheel that is more balanced. Psychologists note that losing a job often equates to the grief of losing a loved one. The emotional journey can include any of the stages of grief, beginning with feelings of shock and denial, then moving to anger and bargaining, and eventually to acceptance and hope. Lastly, we wanted to share some resources for those experiencing disenfranchised grief during COVID-19. Resources include Grief Share, a website that hosts free grief recovery support groups, the National Alliance on Mental Illness website, the National Hospice Care Association website, which maintains a list of hospice care centers offering free or affordable grief therapy, and 2on1.org, the website for the United Way, which provides referrals to agencies and community organizations offering emergency financial assistance to those struggling.